All right, folks, we will call to order this meeting of the Dunn County Health and Human Services Board for August 25th. Let the record show that all of our citizen members are here. Dr. Hall, Mr. Lamb, Ms. Barker, Supervisor Steen is here, Supervisor Hagan is here, and I am present. Missing Supervisor Breslin and Supervisor Robinson. We have minutes from July 28th to approve. I would like a motion. Dr. Hall moves. Is there a second? Mr. Steen, any discussion of the minutes, additions or corrections? No additions, no corrections? Hearing none. All in favor of approving the meeting minutes for July 28th, say aye. Aye. Any opposed? Minutes are approved. I take it we don't have any public comment.
Hello.
Hi, do we have public comment? No, I think.
No.
I think
No,
you
you're
have to go around the, yeah, go through the door.
No, you're fine.
Poor woman said, oh my God, what is she asking me? Okay, no public comment. No public comment. Our next meeting date is September 22nd. Any problems with that? Regular schedule? Okay. Items placed, number 6, items placed at the request of the chair. Most of you may not know this, but each year, the Dunn County Board of Supervisors, each of the standing committees, drafts a series of proposals that the Dunn County Board of Supervisors can send on to our local legislators, state legislators. And usually we have a meeting in the winter. We are planning for January this year to meet with our legislators and review this legislative agenda. I put this on the agenda and then failed to explain it very well to Ms. Winter. So hopefully I'm doing a better job of explaining it here. We have recently, in the last couple of months, designated the Board of Supervisors Executive Committee also as the Legislative Committee, which Supervisor Steen is chairing. So what you got in your package this time is a draft, it should probably be watermarked, a draft Health and Human Services legislative agenda. This actually, I think, is more complete for the Human Services Department with Human Services agenda items and not so complete. I don't know, Greg, there are a couple of items that pertain to you. KT, there are several items that pertain to the Health Department, mostly with regard to communicable diseases, staffing, and water quality testing. But I don't know if the committee would like to review this and look at it again next month, or if you would like to discuss any of these items today. That is, I defer to your wishes here. It is a fairly long list that is built around what we did last year with some very substantial information added by Paula and some quite specific data from the state association. So what is the committee's wish here? Supervisor Steen, do you have any ideas? What would you like to do with this? Want to go through it?
Well, we could, I think, this is, excuse me.
Thank you,
Excuse me.
Dr. Hall. Thank you.
We've been doing this for maybe 2, 3, 4 years. And this is the first time that they designated the executive committee to be the legislative committee. And we are changing from when we would meet with the legislators from in the spring to January. We think we'll be more effective doing it then. This list is, I guess, what I instructed or asked the executive board to do is take it back to your departments, see if there's any changes that you want to make. These have been pretty well vetted before, but not for you folks because you haven't had a
Right.
chance to read them. I guess maybe I'd suggest, unless they want to act on them or, take it home, read about it. And then we want them back to the legislative committee in November so that we can go through them and compile or condense or whatever you want to call it, so we can have our ducks in a row in January. So I think
Yeah.
that's about it.
And I was just getting out ahead of this to get us to look at it because we will have to have a public hearing on the human services budget. And we're going to have to look at budget. And so I thought that we would get it before the committee so we could have a chance to digest it a bit without, lots of other things on our agenda. Dr. Hall.
So a clarifying question, the meeting that the legislative committee will have with legislators, is that with state or federal legislators or both?
State legislators, and our track record has been mixed as far as getting people here. And I just want to put this caveat out. If each department would put out a laundry list of, let's say, 100 items, well, we're not going to go and give them 400 items. The executive committee is going to kind of distill it down to things that they think are most important for, and following the input from the committee chairman. So is that any other questions on that?
No, that's really helpful because because some of the things on here like birth to 3 funding, some of that is federal funding. Is that correct?
It's state money that we're
Is it
asking
state?
for. It's
Right,
state
but
money that we're asking
Is
for
it
here.
funded through both? Or am I misremembering, which is very possible? Birth to 3.
I thought birth to 3 was a federal grant passed on to the state and they
The state that the
That's what I-
state
divvy it
Essentially.
out.
funds or doesn't
Yes, the
fund
state
in
that
that case.
allocates it in our county contract from there. Mhm.
But it's originating with
It
federal.
it is a
funds.
federal program that essentially devolves to the states and then to the counties to run.
So there's no funding that comes from the federal government.
Goes to the state and is allocated by the state to the counties, such
I-
as this.
Yeah, I think it's similar to special ed funding where the federal government gives it to the state, but the state has to have a plan in place and it has to be approved for that grant. But it's the state controlled.
And the
More or
state
less.
determines how much they give to the county.
The state makes the allocations to counties.
Yeah.
Is that,
I'm perhaps obtuse, but if the money originally comes from the federal government, then there's only so big of a pot then for the state to allocate as it will.
but
So I
it's-
mean, we've talked about how it's an underfunded program. So is part of the problem that the federal government doesn't fund it sufficiently? Or is it that somehow it's all going to Milwaukee instead of to Dunn County?
Mm-mm. No, I don't think that's the case. Go ahead,
Right,
Paula.
right. I was just gonna say, I mean, it would be advantageous to have the federal government be aware that we don't have enough funding in that program. I think you're spot on. But then it, certainly goes to the state to kind of dole out in their methodology.
And there's nothing that would prevent, since this is a mandated program, there would be nothing that would prevent the state from allocating additional dollars to the birth to 3 program.
Right.
Just about everything that you see in human services here, we are asking for additional resources. That's true for the items that we put in for veteran services as well. Asking for more money, which doesn't necessarily materialize, but it doesn't hurt to get this out in front of our legislators and tell them about it year after year after year. So that's what we tried to do here. Supervisor Steen.
If it's all right with everybody, I'd make a motion that we take the information we have here, look it over, come back and revisit it at our next meeting
Right.
with any changes that you have or want to make.
Is that a second, Mr. Lamb?
Yep.
Any discussion on that? If not, we will look this over. All in favor, say aye.
Aye.
I,
And we will look this over and hopefully Greg and KT can take another look at it as well. And we'll put it on the agenda for the September 22nd meeting. And I don't know, it would be up to you. Paula sent me some pretty helpful background materials. We weren't sure if it was sort of too much to send on, but if you're interested, we can send that out. Yeah, the head nodding. So if you would, that would be great. It's very helpful. Supervisor Hagan.
This is the fourth year of doing this. What has the procedure been like in the past? From where we are now to legislation that was actually either passed or stymied later on?
You're asking for success?
Not necessarily success, but how has the process been to get to either a successful point or getting it to discussion at the state level?
We have for several years, 3, 4, advocated for more mental health bed space. Last biennium, there was a significant increase in funding, and so additional availability of bed space in Eau Claire. That's been a fairly significant improvement. I'm not sure that I could say that there have been big successes on other things.
The question is, so maybe this is not what you're asking, Supervisor Hagan, but so all of this information gets compiled and then we hold this advocacy session with the legislators, share the information. But then sort of what they do with that, a lot of that, it's just one effort in those. So there was a number of years ago, 4 or 5 years ago, there was a significant infusion of child welfare funding. I'm thinking like of DHS things because that's what I'm most familiar with. And that was a joint advocacy on the part of a meeting like that. Letters and resolutions from the county health and human services boards and county boards, active education advocacy with the legislature by the Wisconsin Counties Association, action teams, ambassador program, like multi-layered approach to the things that are most important. But I think that for locally, it's really our opportunity to have instead of, and maybe there's value as well, me calling a legislator, you calling a legislator, chairperson, more host calling legislator. There's an opportunity to bring them all together, have them all hear the same information, and then they also have an opportunity to comment. And so it's sort of those are telling sometimes in and of themselves, where they say things where it's like, yeah, that's not going anywhere.
Yeah.
To that effect of whether or not it goes anywhere, has there been any feedback for this side of things as to anything we can help to clarify or anything like that? Has there been any legislators or anyone else that came up and said that's might be a good idea, but we just need either more information phrased in a certain way or
Not to
any
my
other data?
knowledge, not to my knowledge. There generally are few questions asked or answered
And then,
in those sessions.
What,
okay.
I think, Andrew, why we made a committee out of it, because we think it's important enough to have a committee.
Yeah.
And secondly, it was designed to, I think, to be a little more manageable with the committee rather than having the whole board act as a whole on it. They are, but it's kind of winnowed down. And in answer to your question, our record has been spotty as far as getting results. But I'm also on the Wisconsin Counties Association board, and we will submit some resolutions to them. And then they'll compile their, and sometimes they match up with what we want, sometimes they don't. But the effect is that we're hopeful that if the legislators hear this enough from the rank and file, which we are, that they'll see the need. And what we try to do is make our requests backed up by information, so that when we get their ear, they know that we are speaking the truth. And they can count on us to give them the facts, in the same way from Wisconsin Counties Association. So, and I think how politics works, if you got enough horses, then you win. If you don't, you don't. But the thing I think that's important is that you build a relationship with the legislators as an honest, straightforward person or a county. And so they tend to listen more if the people talking to them have their facts straight and are on the ball, rather than trying to BS it up and that type of thing. And I think maybe year by year, you don't see it, but over the years, you gain that respect, and then pretty soon they say, hey, Dunn County's on the ball here, and we should take a look at that. That's the whole thing. And we're trying to, and we're open to making changes or getting better at what we're doing. So good question. And any ideas that you have or any other board members have to make us more effective. But when you go to the state budget, there's a lot of cattle at the trough. So, however it works out.
And the session with legislators isn't just a free for all. I mean, obviously they receive the county's legislative agenda in advance. We designate spokespeople who can go through some or all of the items with them, backed up by additional facts. Staff assist with that. And they have every opportunity to ask questions and to come back and ask for additional clarification. So, I mean, we do review this with them. We don't just invite them in and say hi. And
I suppose one of the other things too is how this might be getting in the weeds and might be more a legislative committee question. At this point, how granular of information are we looking at to pass on? Like, are we going through like state statutes and
No.
quoting anything, or just giving them the information and they
well, I mean,
choose from there?
as you see that,
Yeah.
we've defined specific programs for which there is a specific ask, and try to designate an appropriate need or a rationale for the additional funding or the additional support.
And then it would be up for the legislators to.
They do
legislate.
they basically do the granular budgetary stuff. Yeah.
All right.
Yeah.
And then for not oversight, but following up on this information after the legislative meeting with the legislators to like throughout the whole process on that side, is there, I don't want to say accountability, but is there regular contact with them at that level?
Their response to us has not been that great, so that's why we're moving it up to January to try to get them before they get into action. And I think we're trying to impress upon them that this is the voice of the people from Dunn County here. And you would think that if I was running for office or was in office, I'd want to listen to what the people have to say. But on the other hand, like Chairman Morehouse said, once in a while you get a pretty honest politician, and he'll tell you that's not going to go anywhere. Madison is just not going to buy that. An example would be raising the levy limits and the caps,
Which we ask for every year.
And they last year Senator Bierner had, after the meeting, I talked to her and she said, well, it's obvious what's happened to every county. But she says, I would be more in favor myself of raising a sales tax, giving counties a 0.5% or whatever it be to generate more money for. And she says, I think that probably has a better chance of passing than the levy limit and all that stuff. So it's that kind of interchange that you have. But all levels of government don't have enough money. So basically everybody's asking for money, and there's only so much in the piggy bank there.
And at a variety of levels. I mean, the Wisconsin Human Services Association, as Chris indicates, continues to lobby. The Counties Association continues to lobby. This is not the only opportunity they have to hear about these issues. This is just the county's way of stepping up and saying, look, we have determined that this is important to the citizens of Dunn County, and here's our opportunity to talk to you about it. So it isn't certainly the first time that the first or the only time that they hear it. Paula?
The Wisconsin Counties Association also has an ambassador program. And so, for instance, last year I was an ambassador for them, and 4 times a year, there was a day that we would go down to the Capitol and talk about all of these issues. And it wasn't just human services, it was county issues. And so we would sit down and have those conversations as well. So there are, like I said, many different tools that are part of that toolbox. So they hear it over and over and over again. And I know when Chris and I went down last year, the year before, we did ask, what is it that we can do to move these things forward? And they said, your voice is so important. And there's many things that are going through where we never hear the voice of anyone. And so we just don't think they're important because we're not hearing that voice. So your voice is important. So, yeah.
Yeah, absolutely.
Can I offer one more piece?
Please.
So the only other thing that I would say about is that the counties are also in a position of walking a really fine line about lobbying. In fact, we're restricted from lobbying. We can inform, we can advocate, we can educate. But that is why the county employs the services of the Wisconsin Counties Association specifically for lobbying, and other professional trade associations as well.
Thank you, everyone. I appreciate that.
Okay. All right. We will take up that discussion next month. Veteran service. Greg, you are on.
Good evening, everyone. Thanks for the flexibilities. I was unavailable the last few weeks to get my packet out. So there's paper copies here in this room, and then hopefully those that are attending virtually can see the items that I'd sent. I'll start my report off with the Veterans Served report. And again, nothing unusual as far as outputs with our efforts and stuff this last month. The trend right now is all centered around questions and education regarding the new PACT Act that was approved by Congress and signed by the president a few weeks ago, and I'll touch on that specifically. I'll identify. Usually we like to give you a couple impact statements, but again, due to the time, we put one impact statement in, and there's again kind of a pattern that I'd just like to identify, that a lot of in a lot of instances, individuals will come to the office or contact the office for specific questions that are unrelated to what they end up being served for. And I would credit the specific situation to our veteran specialists or benefit specialists, because it's more that holistic approach. I know that's a $1 million word that sometimes doesn't mean anything, but in our instance, it means covering every particular service that we have an expertise on, and making sure the best that we can assess what an individual may be entitled to, because it's their choice to certainly pursue a benefit, but it's our responsibility to educate on what's available. And in this instance, unfortunately, there had been sexual assault while in service, and the young lady didn't want to pursue anything because things at times, you're re-victimizing. And in any way, after a referral to the Crosse Vet Center is one of our partners. It's a program of the VA, and I've spoken very highly of their services because they come to our office and offer counseling and use our front office, and so that's been a good partnership. But that creates that trust. So then, and the end result is that there's a level of trust where the young lady was willing to put a foot forward to pursue the benefit, and the outcome was good. And
Yeah.
you know, for us, it's not the money. I probably shouldn't say that to the here in the board meeting, but for us, it's about the validation. You know, that what they're looking to pursue or what they're identifying as something that happened in service, that it's been validated and somebody actually believes them. And, you know, and yes, there can be money attached to that. So very, very, very good outcome on that. And again, that's just that approach to ensure that we try not to leave any stone unturned, and just to try to build a little bit of that trust so people will go forward on some of these items. If there's no questions regarding this particular report, then what I do is to move to our revenues and expenditures. Oh,
I just have something, could I ask real quick about the intent to file and
yes.
to protect the effective date of disability? I think you may have spoken on this before, but could you go over that again? Because it seems like someone who has experienced some trauma potentially could be losing out on services and help that they could be getting. Is that what I'm reading into that?
Yes, good question. Try not to use acronyms, but sometimes even the words and the statements. What an intent to file is we're letting the federal government know that something's coming. And that date stamps that and kind of starts the clock ticking, so that if there is the possibility that the individual wants to pursue it, when it's approved, it will go back to the effective date will be the date that we submitted that intent. And that can mean thousands and thousands of dollars. And sometimes if you attempting to do a good job on something, you're developing all of the data, you're developing the medical records. And sometimes you have, like in this case, just as an example, we wanted to protect the effective date in case she had changed her mind. And then once she started pursuing and starting to deal with some of the trauma, she had decided, I think I'm ready to pursue this. And then this way, we just didn't overlook. It's a simple signature, you know. So as far as a workload on doing that just, it's a simple way to protect things. So hopefully that answer that.
I guess what's flashing through my mind is from last month, you were talking about a couple of homeless vets in the county, and something like this intent to file, I view as potential people out there who may not know these resources exist. And so when they do come forward, from what it sounds like, depending on what date they file, whether the intent to file date versus an actual file date, if they come and learn about it right away, their resources that they're given after the filing could potentially be less, despite their trauma still, you know, having been that whole entire time that they were unaware of these services. So are they potentially losing out on the back end for just not knowing about it? So this intent to file is to protect that. I see that, but it just seems like there's help that people may not be getting, less help than what they would be if they had known about these services beforehand. And that seems odd and kind of concerning, but I get it.
You're absolutely right on the like the methods of outreach. You know, again, if you have an unlimited marketing budget and unlimited, you know, flashing light boards to get benefits out, and the PACT Act is a good example. Honestly, that is something that, you know, we've already started to talk about a little bit of planning, because that's a perfect example of benefits that it have been opened up to a whole new group, and some groups that are already involved. So that, but it happens all the time, and I wished I could tell you that there's less times that I tell a veteran you should have come in here a long time ago than there is, because you know, that's just the nature of things, unfortunately.
Supervisor Steen.
Yeah, Greg, I see you got the pending appeals and that stuff in there now.
Correct, yes.
Thank you.
Yeah, we had to get a little creative, not in the numbers, but we actually pull it out of the federal VA system, our particular system, because it was onboarded mid-year. This way we can actually pull the pending right out of their system. So it just took a little bit of.
I see June was a bang up month, 267,000.
Correct. Yeah. We I kind of discussed that in a couple of the impact statements last meeting. We had
I apologize. I
some
wasn't here, so, yeah.
we had a couple appeals that were 5 to 7 years old that we had able to present and convince the veterans law judge that they should approve it, and they did. And just to highlight one thing you meant, one of the individuals was able to purchase a home for the first time in her life and has been sober now for like 4 or 5 months, which is not saying that an approved disability helps you become sober. It created hope is what I would attest that to. If there's no further questions about that, regarding the revenue and the expenditures, we're midpoint of the year. There's nothing significant that I really feels necessary to report on. Again, we're just for the group, we're heavily levy funded. I think it's roughly probably 96%. With one grant, and then as well as some Soldiers and Sailors Relief Fund, which is levy specifically for assistance. So we have those 3 cost centers. If there's any specific questions about any particular line item in there, I can certainly address those. But for the most part, our budget annually, it's typically that I would say October, November timeframe is to look in closer. This week, so we don't have it much flexibility in things, but
And we did have who knows where the budget will go, but we do have a request for a part-time staff position in veteran services that is, at least at this point, is still in the budget.
Yeah, we requested 8 hours a week, 52 weeks, and the goal is if it's approved, it's not going to be scheduled out like that because there's heavier flows of activity, and honestly, the timing of it, if approved, is even more important because of the approval of this PACT Act, because the VA's trying to gear up to be able to handle that. That also is going to spill down in our area. So I did read the Colfax paper does a great job, but
Yeah,
I
she
mentioned
does.
something to the county manager that when I read it, it looked like I was looking for a position to come in so I could take a couple weeks off. And not entirely the
I don't
case.
think that maybe did get said, but yeah, no.
Yeah, I know. Yeah, just want to take more time off. So I'll address some local things. I think we're hoping to meet next week with UW Extension. We've been working on a project for probably 2.5, 3 years with the grant, and we're trying to schedule some final presentation. It's all about the veteran experience. We have some data that came from some of the surveys that were conducted. I'm looking right now to try to also schedule with the Menominee PD as well as Dunn County PD to talk about the overall veteran experience and just basically understanding the mindset and some of that earlier intervention. And thankfully here in Dunn County, work closely with all of our other partners here with ADRC, behavioral health, but also with Menominee PD. Has been plenty of situations. We've been in the emergency room with the officer as well as a veteran and visits over to the courthouse. So it's just important to, again, maintain those relationships, also to maybe offer up a little bit more information about what some triggers are, and there's instances, individuals are starting to feel confined that could be a trigger that's just only going to exacerbate. Not that if a person commits particular crime that there's not consequences, but there can be ways and approaches to minimize some of the reactions. And so that's kind of what the goal is, and hoping to kind of get that wrapped up. We've been working on that project for a while. On the state level, there is a update on the legislative piece. The state of Wisconsin did increase the county veteran service officer budget with their last budget cycle of for us at like $1,000. We just need some more births in the county, because if our population goes up like another like 300-400, then we're gonna get some more money, because it's that threshold. So I'm advocating for that.
Work on that.
Yeah. Or to, yeah. Or we can bring in some more people into the county. But they've done, they've been static for 10 to 15 years on that county grant funding. But what I would like to advocate, certainly I'll put that in there, is to, as the state does their budget and they input cost of living adjustments, they should also highly consider comparable cost of living when it comes to funding at a minimum, just to keep up with the trends and the costs. So I'll put that in there. And then the other item on that legislative is there is no federal funding for all of the work we do to help with those to access the federal funding and those benefits. In the absence of the advocates that are doing that work, there would be less people using the VA for healthcare, and there'd be I think a lot more upset individuals, at least if they don't have that. So that's the other. And I know state can impact federal, so even dropping those crumbs, I would be definitely supportive of that if that makes it through. The other thing on the state level is approach to consider running it for our state association as the second vice president. I'm like, what is a second vice president? I usually try to I want to be at the top or win, but I found out that's a progression. So I said absolutely, I absolutely consider it, but I said only if the Northwest Association my cohorts support it, and so that I'll be considered at our next meeting to take on a little bit more of a role. Yeah, it's
Great.
It's probably as you look at the progression within the career, the person should start to get involved more at a state, have more impact at a state level as well as even federal. And then the federal level, the PACT Act. So I handed out kind of a quick question and answer, and there'll be more to follow, but I'm just going to hit a couple of the highlights for the sake of time, because the phones are already ringing, which absolutely should be, and we've been talking about these great possibilities. So from the seat I sit in, some very incredible improvements is the addition of hypertension to the Agent Orange presumptive disease list, and it's very, very prevalent in a lot of our veterans that served in the country of Vietnam. And so many times the VA will deny certain strokes if we're trying to approach that. So this is going to be very, very good. And the other part is past claims, because our approach is if you give us a good rationale, I'm not the gatekeeper to make the yes or the no. I will help build that and develop that claim. So we've got a lot of claims that we've submitted that because of the PACT Act, they'll get letters because they've been denied in the past, and it'll hopefully result in some retroactive money. But I got to look at some of the fine print, because there's some things that they're not going to go back. They're going to just start from effective like October 1st. But either way, that's a huge, huge improvement. The other thing, again, talking about that generation or Vietnam veterans, they added some areas that they couldn't deny anymore that they sprayed Agent Orange in Thailand, Cambodia, and even Guam. which, and I've got to track down a veteran because I put in a claim for Agent Orange exposure in Guam about 10 years ago. So that one I'm pretty excited about. Hopefully they'll go back. I just have to track them down. So those are some huge improvements. And as well as surviving spouses of veterans that have already passed away, that were in Thailand or Guam, and they have their surviving spouses will be eligible for those benefits. So I think the impact, there's a possibility for this to just be an incredible positive impact. And then a lot of individuals more look at it's kind of centered around the newer veterans because it's really framed as this burn pit legislation. But honestly, to me, the most impactful right away is going to be that for those Vietnam veterans. The burn pit, there's a lengthy list. It's a lot of respiratory type cancers. And so far, those have been rare that we've seen. I know they're coming, but they've already started to make some improvements in the healthcare. Newer veterans are more likely to enroll in healthcare than a lot of the older veterans. And so so this is going to create a lot of good positive things. And I think just the recognition that there's a lot of hazardous chemicals that you get exposed to. Me as an example, like I take as many bottles of water. As long as I don't have to go out in the field, and I'm like, even this last 2 weeks, I just stack up as many bottles of water because I don't want to hear 20 years from now that Fort McCoy, Camp Ripley, Hunter Liggett, any of those places are contaminated. You know,
Camp
so,
Lejeune.
yeah, just like Camp Lejeune, because the work that we do. And since you mentioned Camp Lejeune, so I think anybody that watches a television right now sees just the hunt right now for anybody that'll sign a contract with a lawyer there. And so the legislation, I don't know how many billions, off the top of my head, I don't know how many billions of dollars that they've set aside that are allowing the victims of that poisoning to sue the federal government. Just running just the examples of it. So let's say they set aside $5 billion, the contracts the lawyers are signing or that are available are 33 to 40%. So you carve that amount up, that's a hell of a lot of less money that's going to go to the victims. Just because somebody's got to file the paperwork, because now they've removed, and I can't remember the exact term, but they're allowing them just to sue for that. So that's why there's a feeding frenzy right now. And I am going to help a surviving spouse go through and we're going to sign a contract, because it won't impact when we get it approved for because her husband had passed away really young from lung cancer, which is not one of their identified diseases for disability, but it is identified that they'll cover the health care for it. So that, to me, that's a doors open. We should be working on that. So there'll be a lot more to follow. And what I'll probably do is just to kind of target pieces of it to not take up a lot of the board's time, just for an educational piece as we keep meeting here going forward for the meetings.
Just a question, Greg, the rulemaking process here, I suspect, is really complex. Do you have, does the VA issue any guidance as to when that might be complete?
Yeah, well, the guidance is put the foot on the gas and start submitting claims. And there, from my perspective, I'm less worried about their process and them hiring. I'm more concerned about making sure that we get things in and we don't overlook that. But they're highly understaffed, as every organization is, and so they're going to be hiring, and what they'll do is they typically will divert resources from another area to meet the demand, and it just kind of chases the tail. That's how we end up with backlogs on appeals. But
Right.
Their heart's in the right spot. I'm an absolute advocate for what the VA tries to do, and most of the time works out great. But that's why you have advocates and stuff to help through those other situations.
Thank you. Supervisor Hagan.
I just have one question. It says requires VA to provide a toxic exposure screening to every veteran enrolled in VA healthcare. For people at the county level here, veterans who, what does that process look like? Will it be will they be told to come in and get the screening? Will it be just an annual thing whenever they decide to come in? And then after that screening, are you automatically notified with that? Or how does that information from that point get to you in order to start the claims?
The only way any information gets to us is if the veteran brings it to us. The VA, it's a one-way street. I get that back. They're very good in our region. They're very good about advising a veteran, go talk to your veteran service officer. So I don't want to minimize that. They do a great job on that. But how these screens work, because there's been an Agent Orange registry since probably 1980, maybe longer, and so I haven't been a huge advocate for that registry, and I'll tell you why. Because that registry, I've seen it used to deny, so that you go in to get on this registry, and you have a good health check. Then they're going to say, well, you're healthy. So then later when we pursue a disability claim, well, it's not associated to service. But the other piece of that is that the registry is supposed to immediately put you on a mailing list, a contact list for things that change, but that hasn't been good. This might change. This might be different. So I'm hoping that, my mindset will change on that, that they will be contacting, because there is a lot of information that's been put out by the VA. So I'm hoping that has been improved, because again, it comes down to capacity, and when I talked to the department that handled the Agent Orange screenings, they're like, yeah, there's just one of us. And so I think they'll address this one differently. I'm more optimistic, certainly, but they have to bring it back to us.
All right, so any veterans in the county would have to actively pursue this screening. Is that what you're saying?
Yeah. There's online registration to get your appointment and stuff. So, and few people have done it. And, and I guess I'm more worried about the claim side with, the disabilities that they have going on. And I do know that they're actively doing a research project, because there's a lot of infertility issues, like 2 times as high for veterans of the recent wars.
Dr. Hull.
So Supervisor Hagan, to kind of speak to the bullet point that I think you're asking about. So that bullet point is for veterans who are enrolled in VA healthcare. So these are people who are already going to VA clinics for healthcare, that they will get a screening. So I think, as you kind of even alluded to earlier, that there's a potential big gap here, right? Because there are people who now will qualify for VA healthcare who aren't currently getting it, but there's no system for screening those people. They have to self-identify. So that does make it really important then for kind of the marketing, the information piece, to let these folks know, because they're not in the VA medical system yet. And some of them are, some of them aren't.
I'll just use a quick example to wrap this. I'll self-disclose. Typically, I don't self-disclose, but I'm a veteran who fits in that gap, that I am eligible for VA healthcare because of being in the over in Iraq in 2004, but I didn't apply within a 5-year window. So then I'm not eligible based upon income. And so they're correcting that, because again, if you want to have people get screened and use your services, they're opening that back up. So hopefully that'll increase some more of those screens.
Okay. Thank you for that. Anything else, Greg? Any other questions for Greg? As always, a good report. Thank you. Thank you for keeping us informed on this. Casey, are you ready for agenda item 8, Department of Public Health report?
Sure, absolutely. So I'll go ahead and share my screen. I did send it out virtually, but it was very much last minute. Oops, I am not able to share screen. So thank you so much. Okay. Let me just get up to, all right. Okay, so this looks very familiar to this update on COVID-19 and where we're at. Also sharing the key levels and advanced so we are, when the CDC moved to community levels, they really took into consideration that as people have more vaccine immunity and infection immunity, that the hope is, and what we're seeing is that we are seeing less hospitalizations. The cases remain fairly high using that older number of transmission, which are long-term care facilities and CMS regulated facilities are still required to do. We are not seeing the hospitalizations and the RFs. So I'm going to continue with that. High in the last couple of weeks, our hospitalizations are up. Monkeypox, you have two different things to talk through. Monkeypox as well, as far as a press release that we put out and the regional situational report. That's from the Western Wisconsin Public Health Readiness Consortium. Those of you guys that have been with the Health and Human Services Board for a couple sessions or years rather, this situational report is going to look really familiar to you. Our director of the consortium started adding in monkeypox information, and so I'll scoot over to that in just a quick minute so that you guys can read that at your leisure. They're all hyperlinked, and so for a little light reading or cure for insomnia, there's no sources in that to report to update. So program updates for Public Health Administration. I had the opportunity to do 3 different TV media interviews, and I really appreciate our media partners because they did pick up the press release and reach out in a way that helps people understand their risk and prevents, I think, really minimizes stigma in how that's presented. So I really appreciated them for that. Within our public health nursing program, the HCET or the healthcare education folks that help us at statewide level around reproductive health education did highlight our outreach in our reproductive health clinic with our, and I am going to call them happy little condom bags because they all have a little cheeky saying on them, really walking that line of being funny without being crude. And I know that many of our partners, the bars, the community organizations really appreciate the new batch because they're always themed around the season. So I wanted to highlight that as well. We did do a VFC or vaccine for children emergency preparedness exercise today in Boyceville, where we received additional vaccines for school-aged children. And so 3 nurses were in Boyceville today. They were able to get 10 different kiddos up to date on their vaccine as their parents asked. And it was independent of their typical eligible vaccine health permits, underinsured or uninsured people or folks because of their background. So that was nice that we were able to go to an area where it is a little bit of a trek sometimes for families in Boyceville to get into the clinic vaccinated. And those nurses were able to kind of vaccinate with a variety of things in quick succession. So that was just a couple of hours this afternoon. Great. I was going to give you an update on 2 quick things in environmental health. One, to give you an idea of kind of what we saw trends over the last couple of years with COVID-19, where we did have a reduction in licensed facilities. Folks chose to not open, specifically some of our tourist rooming houses and others that were very focused on businesses that were not able to stay open because of some of the impacts that COVID had on the community and their business model. We are seeing businesses open, an increase in opening businesses, specifically in a couple of different sectors. We saw a lot of mobile units this year in a way that we hadn't seen before. A lot of tattoo facilities, specifically permanent makeup, seems to be a big thing in Dunn County right now. So we've had a 250% increase in our tattoo here. So that was interesting. And the other thing that I wanted to point out is that we are working to support zoning with an additional septic inspector. So throughout Wisconsin, septic inspections are sometimes seated in zoning and other times seated in health department. And so in Eau Claire, when I was the environmental health supervisor there, we also housed the POUTS program. I have inspected septic systems, but in Dunn County, that's housed in zoning. Unfortunately, there's just one that's used. And so when construction is good and things are busy, there aren't enough people to do the work. And so we're stepping in to support. And I wanted to highlight that our environmental health manager, Jeff, was able to complete that certification, pass his exam, to help out in that. And then lastly, a couple kind of follow-ups on public health nutrition or WIC, getting back to the formula shortage and how we are continuing to have challenges for families. We need to help coordinate with that. Not that we receive formula, but we do have good relationships with vendors. And so oftentimes we know when some of those specialty formulas are coming in for shipment and we are able to call our families and advocate for them. And then I know that some of the board members are in our farmers market nutrition program. And so right now, just giving you guys a year to date where we have issued over 1,500 checks, not quite 10 grand worth of produce. Those dollars are put back into the local economy and the pocketbooks of our So let me go through a couple things really quickly, and I wanted to show you what you can expect. So this is the situational report, a lot of information and updates for both monkeypox and COVID. I would encourage you to and the press release. So wanted to bring you guys up to date, and I'll start trying to see you guys a little bit. About monkeypox in Dunn County. We have had a single case, an individual that had and did not have any contact here in Dunn County. My team, as well as teams from the state and interstate epidemiologists, did contact all of the known contacts and look at our practices. Now I know how we should do with that. So I was doing that disease investigation. And we are talking with our schools as well as the university about what kind of risk we are looking at. And I look up the state cases every week. So as of Monday, we had 52 cases within the state of Wisconsin. So very low number of cases, and that we're not seeing a lot of cases of numbers. And so it's possible, just like we see with other things, we have an exposure within your social circle, but then you take that back to your home environment. Monkeypox does require safety contact, and so there is a risk within the household to have exposure to other household members. And so doing some education about if you have household contacts, how to prevent transmission. So you have issues with health contacts that you don't know, and that can move into another social circle potentially. So continuing to do that work. All right. Any questions about the update?
That was yesterday, and a woman behind me said, "Oh, where are the WIC people? I love them."
Yeah, so our just to partner with how to use your benefits in finance. So that was really great to hear this come down, and they're pretty capable. So good to hear that. Thank you for that. Thing.
Are we doing anything with the that's in Bristol now? There's one on Thursday nights. I haven't been there yet because I just got here right now. I'm not sure they'll tell you can't drive for months. But it's slowly tonight it's there. So I was just wondering how that if we're supporting that if people can use the vouchers there. Or,
Yeah, so I think that also back to raise our level of I do believe that the farmers get to in all of the locations. Well, I'll get specific follow for you. We don't have all the rights at Voice One, so that's another opportunity. We can get volunteers to travel. Maybe opportunity to actually very well to know specifically people to travel that way. But that might be another opportunity. Thank you for doing that.
Any further questions for Medical?
I just want to say thank you for deeply informative and really give people a sense of what the situation is and isn't, and also did a really good job of talking about communities that are most effective while not using types of thing, which is tricky to do. So thank you for that as well.
Yeah, definitely an important line to be aware of. I think that we talk more about this. I think that it would be important to be able to share targeting messaging with the community community member, and so I think that's something that we are looking to engage health providers or other trusted members to actually work within the community for the community. But that is another voice that I can help with at this moment. So stay tuned.
Okay, moving on. Financial report. Do you want to do that?
Sure, absolutely. So I'm just sharing my screen a little bit. Okay. So that's 8B if you're following along with the agenda. So I wanted to share a couple things. One, this is the last time you'll see this format. So Beata, our CFO, has created the mother of all spreadsheets, and it's gorgeous pivot table that just imports the data with very minimal touching. So it's going to save finance a little bit more consistent format for some of these more tricky budgets. So I understand that DHS is moving towards this, highway is moving toward this, because though we are small, we don't have a budget, and so Beata did all the formulas for us as well. So this is the last time you'll see this this one. So looking at our roll up, I wanted to point something out really important. So you'll remember that last month I had talked to you guys about at that point in time being concerned about needing to ask for a levy, but being cautiously optimistic to the tune of about 17 grand. Being cautiously optimistic about not needing that due to having just being very early in the year with our actual revenues and not understanding really, because nobody has a crystal ball, what kind of COVID impact and then access to COVID communicable disease funding we would have. And so one thing that I wanted to point out, sorry, I spoke too far, is that we did receive a significant amount of, just because of billing, communicable disease funding, because when we had done the numbers, we had revenue for January and February, and we had received March, but it didn't make the cutoff into packet, and I received 2 additional payments. And so we're actually showing that because of communicable disease and the revenue that we had incurred or received due to costs incurred, that we are not at this moment in time showing a deficit, but it's still pretty early for us to know for certain. And I'm trying to not scroll us and give you guys a little bit of motion sickness. But overall, at this moment in time, we're expecting to have a surplus of budget. So anticipated levy at this moment in time, again, I would not take this to the bank because we just don't know how it's going to shake out. Looking to put it 160,000 back in. So again, but with the first 4 months of revenue from communicable disease follow-up really offsetting the time that would be put into other places because we couldn't do the reproductive health work. Some of the administrative work that I was doing was literally getting food stuff to people that need ICs, so offsetting my costs. And sometimes that there is, at this point in time, an expectation that we will be at least levy neutral from what we asked, not asking for additional levy.
Great. Very helpful.
I have a question for the budget coming up for 2023. Between any communicable diseases funding that may sunset coming up and in country, was there any money to any increase in ask for either reproductive health or WIC or maternal health, any of that stuff that may potentially within the next year be increase in asking those programs?
So, I believe in the kind of legislative process. There is a request for continued and consistent funding for things like communicable disease. There's no funding for people with disease unfunded committee. This the COVID we receive about $4,500 a year for communicable disease follow-up. That really doesn't fund all we do from familiar to E. coli to all of the required follow-up. So I think it's functionally under or unfunded. So we're asking for more. We're asking for but so you remember there's a lot of money that went into public health. If you remember H1N1, there's a lot of money that went into public health. And we're seeing that again. So that kind of consistent funding so that we can be so that's something that we try to educate on. Again, thinking about county manager plus advising that we need to be mindful that we are only educating and we are not doing capital use. We're not allowed to do that.
Thanks in the legislative agenda pertaining to communicable diseases. Thank you. Any other questions about budget projections, revenue, expenditures for KT? Thank you, good report. Appreciate it. Not Human Services Staff Report. Ms. Winter, you're on.
Thank you. Good evening. In your packet, you found my Human Services Director's report for the month. I really wanted to focus on giving you a little bit of information as to what I was doing, because I know when I interviewed, you said, what will you be doing your first month, your first 6 months, all those kinds of things. So I thought it was important that I give you that information, and really that much of my time was spent in that community partnership and understanding the programming staff and those sorts of things. I also attended the PTAP training, which was in Chicago, that really looked at those 6 pillars of deflection for individuals with drug abuse and criminal behaviors. And so that was very interesting, and I looked at some of the relationships with those partners that went to Chicago. And so you can read more about those things in the report. Let's see here. I did want to talk just a little bit about the community development grant, because I participated along with a fiscal person with a meeting with the Department of Administration this week, requesting that the funding that we received for the CDBG would be able to extend through the end of 2020 as well, and in meeting with them, they talked about the need for increased funding in areas of construction, that the cost for construction, as you all know, has just skyrocketed. And so they're thinking that most of the construction grants is the type of grant that we have. But they said in order to make the ask, so we are making the ask and see what comes out of that. I want you to be aware of that. There's a high likelihood that we may not be able to carry that past. That may be challenging for our partners. And we're working closely with them to monitor what they're using now. And it did take a little bit for the housing projects to get going in the beginning of this. And so we may be de-obligating some of the funds, to be able to use them right now. So that at the end of the projects, we may de-obligate some of them. If we were able to do it longer, we won't be de-obligating them because we would use them as some of the housing projects. So it's unfortunate that we may not be able to carry that longer. So I wanted you to be aware of that piece. Questions in my report.
Any questions for Paula?
in the report.
Oh, yeah, Mr. Lamb.
Not really a question, but I'm gonna give you a big yes, way to go. I read about, I mean, check mark buttons, I thought it was so good that you sat down at the front desk and answered the phone. And I'm quite surprised that was the way to know your new department, so.
Thank you very
yes,
much.
all
Thank
right.
you. Yeah.
Kind of like Baby Scarlet.
Yeah, well, I had some fun too on there, so yeah, all right. So during the last meeting, you asked questions regarding the aging population, increasing population, and all of those kinds of things. And so I did some research. This was way back in 2010, and we started talking about what will it look like in the future with baby boomers retiring and all of those pieces, and moving forward, into the aging system. So I have these, I think it's Crosses that I have to use to move this forward. Thanks for that. All right, so I'm not gonna go through the drawing. This is where it was first presented, was at this aging in 2010. Like this in Wisconsin and Dunn County, we were in the yellow population of 12% or less people in Dunn County being 65 and older. So that was 2010. Let's move through this a little bit. We moved a little bit into that little bit darker, or the green section at 12 to 15%. 2020, we still were in that green, just a little darker green. Now let's go to 25, is that 18 to 21%? 2030, we turned blue with 24 to 27%.
Wow.
2035 is still in that blue, and we go down to 2035 is the top that they have in this projection here. But you can see that number is really increasing over time. So, any questions on that?
Just like, based off of our current population, not predicting or guesstimating any new births during that time, like is it just taking what we are now and aging everybody? Is that what this is showing?
Based on percentage of where we were at, obviously, they don't projecting how many births we had in 2010, how many, what the aging is, and then moving that all forward based on that time frame, what they knew at that time. So obviously, it's not on our current census data or any of those types of things, but yeah.
Okay, so it's like consideration future births. in that.
Yeah, based on kind of moving that all forward.
Fascinating. Expensive.
Expensive, yeah.
Very expensive.
Yeah.
Dr. Hall.
So these are percentages, and if you guys don't know what our county population in terms of numbers, has it been going up? Has it been going down? Has it been steady?
It grows a little.
Sure.
We're
So
about
small
60,000
growth each
a year.
year, right? The number of people who potentially need services, right? So if our county was shrinking significantly, then the fact that it went up to 20% would be like, well, maybe the same number of people. But so okay, thank you.
And I haven't, it would be something that we could at some point look at. I haven't looked at most recent census data for the county. It might be sort of interesting to take a look at what those numbers are. Because I can't specifically answer how much we grew in the last 5-year American Community Survey. So yeah.
Thank you, Chris.
Okay, any questions for Paula about budget?
Oh, yeah.
I'm sorry, Dr. Hall, I wasn't looking.
So I was just wondering if you could give us a brief, at the time that the report was written, of course, you hadn't had the Health Done Right Steering Committee meeting yet, but you have. So I'm afraid you guys need to wait till next month's meeting to hear if there's anything kind of big or exciting or that we should know about that came out of that.
I'm trying to remember. That's been a couple days ago now. We went through what each of the areas were, and have my notes back in the office. But I will remember to put that in my report next month. But I don't think there was anything big. It was really more of a lot of education of the community getting out into like the farmers market and all that. I can tell you that because part of that we had a presentation on marketing and how to really get out marketing materials for alcohol, nicotine, and drugs. Whether it be prevention or early intervention. Meeting that we hired Limelight, I think the name of it was, and they presented on how to really focus on narrowing our field as to what we're looking for and not being too broad, what types of social media to use, and really fast on how to do that. And so I can put that in a little synopsis in my report.
Katie can also help on what the action teams are doing. The housing study, Paula mentioned that her report, the housing study is underway after months of delay, and we're excited about that and what possibilities that might offer us for activities on which the county can hopefully have some impact. Supervisor Hagan.
You mentioned when the housing study when it ends, like when you expect
So
that.
the report will be made available to the county board in March.
Thank you.
But you will be hearing about community forums and other opportunities to learn and participate as we move along.
And I think the survey closes September 12th.
19th.
Budget, yeah. All right, so you have this in your packet, and the good news is we are, with the projection at the end of the year, we're looking at a 1.495 million number there. I can tell you that this has done very well this year. They've done a great job of when there needs to be a placement, that it's with a family member or foster home, trying to keep children and youth out of those expensive placements. Really looking at how can we keep them in their homes and communities. I did a family and children's service meeting, and I was pleased. I think I told Chair Morehouse this when I went to the meeting. They talked about an individual that had some pretty high needs of youth and what they could do, and cost pretty high in the community. And I said, well, that's going to be expensive. And they said, but Paul, it's so much cheaper than a placement. And so the philosophy that Chris has really built up in there, and they said, you're right, it is. It's a lot cheaper than a placement. And actually did the math and started using and such. So that was something that I've heard a lot about in different forums. And it was fun to see it come to life with the workers actually talking the talk, like how do we do this and the reduction of trauma by keeping kids in their own home and stuff. So that just the person pushing us to this point to be able to have that. So it was delightful to be able to be part of that. So that's a piece of this is that savings with those areas. Certainly we've received some funding, grant funding, and those kinds of things to help with that this year as well to keep those numbers stable. So with things continuing like averaging the year, but knocking on this fake would things stay the same.
So that would be another year of returning funds to the general fund, which is amazing and speaks to management. Any questions for Paula on budget? Oh, well, good job.
You can let me off easy. Thank you.
Turn on your mic.
Sarah brought me off by giving me a poke at the budget meeting, so I'm going to refrain.
Report. I have a couple of action items. First, we need to note review of the July vouchers that was in your packet in the amount of $56,104. Any questions about the vouchers? Any motion to move? I Dr. Hall first. Second. And Supervisor Steen is the second. Any further discussion? If not, all in favor, say aye. Any opposed? July vouchers are noted. Yes, Supervisor Steen.
The Polyos was $1,495,000. Is that including your $20,000 or not?
So we are different departments. I think you should hold that. It does not include us in it make 160,000.
160,000 return. At this point, it's July. It's July. All right. And moving along, we have a budget adjustment from public health. If you want to address this, please.
Oh, go ahead and introduce the
Please.
I'm sorry.
No, I just please.
All right, so item 11, this is no cost extension from our public health emergency preparedness grant from last year because we were all in it with our COVID response. We ended, and this is not a calendar year, but it is a calendar year, fiscal year, sorry, grant. And so we had this amount given back to us as an extension because we were not able to use it in the original time frame. And so there were some limits that we did, of course, capturing additional personnel costs and making sure that people had up-to-date computers, and that'll go against the escrow that we have for IT. It's not an escrow, the kind of budgeting process for new computers. These things will get taken out so that we're not having to put squirrel quite as much away for it. That's what this is for.
Dr. Hall, do you have a question? Oh, all right. I need a motion to approve. Big further discussion on the budget adjustment. Not all in favor, aye. Aye. Opposed? Budget adjustment 2022 is approved.
I'm moving.
And without objection, we are adjourned. Thank you.
Is September 8th, I believe, at Wakanda Park. And I would encourage you to attend if you are so fine. It's the best deal you're gonna get for $5 a year. On the 8th, starting right after work at 4:30.
Everybody's invited. All right. Thank you, Katie. Thank you, Paula. Thank you, Chris. Thanks, Greg. Thanks, everybody.